Let me just first start off by saying what a pleasure it is for me to be here today on behalf of Canada's Prime Minister, Stephen Harper. At the luncheon today, we talked about political will. And let me assure you, Canada has the political will that the mothers and the women of the world deserve and will continue to have. On behalf of him and all Canadians, our thanks to both PAHO and the World Health Organization for their acknowledgement, and I quote, "The exceptional leadership of the Government of Canada in promoting the health of women, mothers, and children globally and in the Americas." Do you know, our relationship with both organizations are extremely important for Canada. I think if you note, we demonstrate this because, as you know, Ms. Bachelet, Ms. Chan, and myself, we're all wearing the same color. That's how closely we work together. In particular, I would like to thank Dr. Myrta Roses for inviting Canada to speak this afternoon, and to Dr. Margaret Chan for her outstanding leadership at the WHO. PAHO is playing an important role in moving the health agenda forward in the Americas. For example, according to its statistics, maternal mortality has seen a 40% reduction between 1990 and 2008 in the Americas region. Over the past decade, PAHO has been integrating the MDG targets into technical cooperation programs addressing issues such as hunger and malnutrition, gender-based inequality, and maternal and child health. And as we all know, integrated approaches are more effective and deliver better results. Canada also appreciates PAHO's efforts to transfer knowledge, such as the exchange between Tierra del Fuego and Inuit people in the Canadian North, as well as more broadly among donors and member countries. Today's event and your collective ongoing work is an important opportunity to strengthen our resolve to intensify our efforts to achieving Millennium Development Goals 4 and 5, 6 by 2015. The thought, foresight, and solid research behind PAHO's plan of action on the reduction of maternal mortality and severe morbidity, which I know you'll be discussing today, is to be highly commended. It's a plan that addresses known gaps and is results-focused, while being well aligned to global commitments and strategies. And I applaud PAHO and the WHO for going beyond official MDG targets to address the major disparities concealed by national averages. It's been quite a year for maternal, newborn, and child health. Beginning last year with the G8 in Canada and the resultant Muskoka Initiative on Maternal, Newborn, and Child Health, followed by the UN Secretary General's Global Strategy for Women's and Children's Health, and then the establishment of the Commission on Accountability and Information for Women and Child Health. Through these initiatives, the international community pledged unprecedented resources to improving the health of women and children, and Canada is proud to have played its part. Just last week, at the UN Secretary General's Every Woman, Every Child event in New York, an additional 100 commitments from the private sector, private foundations, and civil society were announced. These commitments included better access to vital medicines, more funding for research into diseases, more funding for methods for strengthening health systems, and more funding for training community-level health workers. Making commitments is only a first step. Respecting commitments is important, but in the end, we must deliver results. How many lives are being saved? How many mothers are giving birth with a skilled attendant present? How many newborns have made it through their first year? How many children are reaching the age of 5 and can attend school well-nourished and ready to learn. When we can answer these questions and show progress, then we will know we are truly making a difference. Beginning with our G8 presidency in 2010, Canada has stood for ensuring that all of our commitments to women's and children's health lead to tangible results. The Commission on Information and Accountability for Women and Children's Health, co-chaired, as we know, by Canada's Prime Minister and the President of Tanzania, brought together leaders from different countries and organizations around the world to work decisively and deliver a report that was officially released last week at the Every Woman, Every Child UN event. The Commission completed its work in an amazing 5 months. It was focused and targeted, practical and action-oriented steps to marshal the international goodwill backed by over $40 billion in pledges into recommendations that we should all adopt. The report sets out 10 action-oriented recommendations for concrete steps to better match results achieved with resources committed. They aim to have all parties, donors, partners, governments, and communities work together to improve health information systems at global and country levels and to track the flow of resources. They're based on an accountability framework revolving around a cycle of monitoring, action and review, leading to continuous improvements. They encourage greater transparency by all partners in meeting their commitments and ensure that the resources are spent wisely so that the desired results are achieved. Recommendations for countries include tracking a core set of 11 indicators by 2012 to serve as the basis for measuring results, particularly those MDGs where performance is lagging the most, as outlined in the global strategy. For example, the Commission's report recognizes the critical importance of the registration of births, deaths, and causes of death, and the need to combine data from all sources. It recommends that all expenditures, including forward-looking commitments, be tracked. It also recommends exploring opportunities for innovation in information technology to both gather reliable health information and to improve access to it. At the global level, the Commission recommends new systems at the OECD to track whether or not donors are living up to their pledges they made. And it recommends an independent expert review group be established and that the group's membership be announced as soon as possible. And Dr. Margaret Chan announced the membership of the expert group last week in New York. So congratulations, Margaret, on your speedy action in this regard. It's what we expect, and we've learned to get when you ask Margaret Chan to do something. Since the final meeting of the Commission in May, the final report and recommendations have received strong support at the World Health Assembly, the G8 Deauville Summit in May, and the June meeting of the PAHO Executive Committee. We encourage all partners, every country in the Americas, and every country that works with the Americas to look at the report, consider its recommendations, and I ask you to commit to adopting the recommendations in the report. All of us who are partners in this fight to save lives must keep a resolute focus on this need to turn our commitments into real action, to deliver measurable results and outcomes. For our part, beginning with our G8 presidency in 2010 and continuing with Prime Minister Harper's co-chairmanship of the Commission on Information and Accountability, Canada is proud of its outstanding support in this effort. As the Prime Minister said last week at the Every Woman, Every Child event in New York, and I quote, "Accountability depends on vigilance and dedication. If we do these things, we know we will save lives. We always need to remember, as we press for accountability in every step of the process, that mothers and children in the world's poorest countries are counting on us. If it matters, measure it. Well, this matters," end quote. And of course, the countries of the Americas are a critical part of the global effort to improving health outcomes for women and children worldwide. That is why I am pleased to announce that Canada is supporting a new 3-year initiative with PAHO designed to strengthen basic primary health care systems and service delivery in Latin America and the Caribbean, as well as to increase protection from communicable diseases as part of Canada's ongoing commitment on maternal, newborn, and child health. The project will focus on 3 of the 6 components of a well-functioning health system identified by the WHO, and they are governance, health services delivery, and health information systems. Through this project, PAHO will work to establish coherence between national strategies, action plans, public policies, legislation, and financing mechanisms, so that the people of the Americas will ultimately have universal access to basic primary health care services. PAHO will collaborate with national health authorities, local and district health care institutions, as well as communities, to deliver services, and then work with them to improve the collection of health information through surveillance systems and databases. And CETA is proud to count PAHO as a key partner in helping to improve the lives of women and children in the American hemisphere. Canada is committed to doing its part in meeting the Millennium Development Goals by 2015. And as neighbors in the American hemisphere, we are proud to support PAHO in its work to improve the health of the peoples in the Americas. We are one of you, and we will help. We also ask for your help to enable us to help as well. So we are in true partnership, not only institutionally, but with each of your countries, with each of your organizations, and with civil society. Thank you. It's been my pleasure.